Sirukumab is safe and efficacious in the management of rheumatoid arthritis. In rheumatoid arthritis, the interleukin levels in serum and synovial compartment are increased. The high concentrations of interleukin-6 aids in the stimulation of leukocytes to the joint, promotes osteoclast maturation and activation, suppress chondrocytes, and stimulates synovial proliferation, which contributes to joint damage. Sirukumab is human monoclonal antibody that selectively binds to interleukin-6 with high affinity. It has shown to efficiently alleviate signs and symptoms associated with rheumatoid arthritis. The aim of the study was to evaluate the efficacy and safety of the drug Sirukumab in the treatment of rheumatoid arthritis, which is refractory to disease-modifying anti-rheumatic drugs. The study was a global, phase 3, multi-center, randomized, double-blind, placebo-controlled, parallel group study, with a sample size of 1,670 subjects. The inclusion criteria for the study was patients aged greater than or equal to 18 years, patients who has moderate to severe rheumatoid arthritis, patients who were refractory to disease-modifying anti-rheumatic drugs, patients in whom the C-reactive protein levels were greater than or equal to 8 mg per liter, patients with anti-citrullinated peptide antibody, and rheumatoid factor positive. The patients who had a history of any infection were excluded from the study. Overall, 1,670 subjects were included in the study. They were randomized into 3 groups. One group was administered placebo. In second group, Sirukumab 50 mg was administered every 4 weeks. And the third group was administered Sirukumab 100 mg every 2 weeks. The results were concluded based on the endpoints, such as proportion of patients with an ACR20 response at week 16, change from baseline in SHS results at week 24 and 52, and proportion of patients with no radiographic progression from baseline to week 52. The proportion of the patients with an American College response, 20%, in the week 16 were 26% in placebo group, 55% in the group that was administered 50 mg Sirukumab for every 4 weeks, and 54% in the group that was administered 100 mg of Sirukumab for every 2 weeks. The Sharp, or Van der Heijst, score results at week 24 were improved compared to the baseline readings. The Sharp, or Van der Heijst, score results at week 52 were improved drastically compared to the baseline readings. The proportion of the patients with no radiographic progression improved in Sirukumab treated group compared to the group treated with placebo. The study concluded that Sirukumab was a safer and more effective drug with safe profile that had shown overall improvement in the quality of life in the patient with rheumatoid arthritis.